My name's Sylvia Arzonia. I'm a radiation therapist at the Walker Family Cancer Center. When you arrive for your radiation appointment and have been shown how to scan your schedule, a radiation therapist will come to get you from the main waiting room to bring you around for your treatment. You will be asked to change into a gown, removing your clothing from the waist up off, including your bra. You will be asked to place a gown so that it ties in the back. Once you are changed, you will take your clothing and personal items with you to the radiation therapy waiting room. The radiation therapists will then come and get you from the main waiting room to bring you into the treatment room. We will ask you for your birthday every day in the room to verify you are the correct patient, but also to ensure that our computers have your information pulled up for treatment. Once in the room, you will be lying in the same position you were in for your CT simulation. The radiation therapist will uncover you just enough to see your tattoos. We use the tattoos you were given in your CT simulation appointment, along with laser lights in the room, to position you in the same position that you were scanned during your CT simulation appointment. If we need to move you, we ask that you lie nice and heavy and do not lift up or help us unless specified. We work within millimeters, so it is easier for us to get you in the correct position without any assistance. Once we have you in the correct position, we ask that you do not move. You will hear us calling out measurements. These are used to just verify your position. Once we have you in the correct position, we will step out for the treatment. However, we can see and hear you at all times through our various cameras and intercom system. If you need us for anything, you can call out and we can come back in the room if needed. Depending on your planned treatment, we will have different imaging protocols that will be explained to you on your first day by one of the radiation therapists. For the imaging, you may notice parts of the machine are moved out prior to the staff leaving the room for your treatment that will take the appropriate images. If any of the verification measurements ever vary, the radiation therapy staff may take an image that day to verify your position. If our images and all our measurements are within tolerance, we will begin the treatment. Once your treatment is complete, a radiation therapist will let you know and bring the bed down to a safe height for you to get up. If, for your particular treatment, you have to hold your breath, you will notice colorful lights turn on during your treatment. This is part of our software that is used to track your breathing. On your first day of treatment, we will have to set up these cameras specific to each patient, so this may add a few minutes to your appointment time. In addition to the software, we will have a tablet available that will be placed in front of you. This will help you visualize your breathing. You will see a green box and a yellow bar. The yellow bar represents your breathing. You will be asked to aim so that the yellow bar, your breathing, is in the center of the green box when you are asked to take a deep breath in. If your breathing ever falls out of the green box, do not panic. The radiation will also turn off. The radiation is only delivered if your breathing is within your custom breathing range, which is represented by that green box. This also means if you are unable to hold your breath for the entire duration required, you can breathe normally, catch your breath, and once you are ready, the staff will instruct you to breathe in again to complete the rest of your treatment.
Welcome to the breath hold teaching video for left-sided breast or chest wall radiation. Hi, my name is Marty. I'm a nurse in radiation oncology and I work at the Walker Family Cancer Center. In this video, you will learn how to hold your breath during radiation treatments to your left breast or chest wall. You have been asked to hold your breath because your treatment will be on the left side of your chest. Taking a deep breath in and holding your breath pushes your heart away from your chest wall and out of the treatment area. It is important that you start practicing by holding your breath several times a day for about 1 week. This will help your lungs learn to expand, and over time, you'll be able to hold your breath longer. You should be comfortable doing this in time for your CT simulation appointment. Practice holding your breath by laying down on your back on a bed with a pillow above your head. Raise your left arm over your head and rest it on the pillow. Take a deep breath in, Slowly through your nose and hold. Aim to hold your breath for 40 seconds at a time. You may not need to hold your breath this long during treatments. If you can hold your breath for 40 seconds during practice, then you will not have any difficulties during your treatments. Practice this several times a day. Take a break if you feel lightheaded or dizzy. When it's time to hold your breath during the CT simulation and treatment, you will be asked to follow these instructions. When you are ready, take a deep breath in and hold. When it's time to stop holding your breath, you will be asked to breathe normally. There's a chance that you will not need to hold your breath at all if your heart naturally lies far enough away from your chest wall. We will know more when we do a CT simulation. If you're having a very hard time holding your breath, we will use other measures to protect your heart during the radiation treatments. Welcome to the teaching video for the application and use of cavilon spray during the breast and chest wall radiation treatment. In this video, you will learn how to properly use a barrier spray to protect your skin when receiving radiation treatment to your breast or chest wall. Skin changes are a common side effect for breast and chest wall radiation. In order to decrease the chance of skin breakdown, you are being asked to purchase and use cavilon spray. This barrier spray makes a waterproof layer that covers your skin. It lasts for up to 3 days. Before using cavilon spray, make sure your skin is clean and dry. You may find it easiest to apply it just before you get dressed. Hold the bottle about 4 to 6 inches away from your skin. Spray it onto your entire breast using a smooth, sweeping motion. Spray under your arm with 1 to 2 sprays if you are being treated there as well. Allow the area to dry for about 30 seconds. Then lift up your breast tissue and spray in the fold. Allow that to dry before releasing your breast to its natural position. If you've had a mastectomy, spray your entire chest area from your collarbone down to the level of the bottom of your sternum. If you're being treated with radiation in your underarm area, spray there as well with 1 to 2 sprays. Allow the spray to dry for about 30 seconds before getting dressed. The barrier spray does not need to be washed off before putting it on the next time. Your skin may look flaky as treatments continue. This is okay. It will not change how the spray works. Please do not use any ointments, creams, lotions, or gels in the area where you're using the spray. These products may affect how well cavilon spray works. You may, however, use these products on any other part of your body if you like. Please use the cavilon spray when you start your radiation treatments and continue to use it for 2 additional weeks after the treatments are over. We recommend using it on Mondays, Wednesdays, and Fridays for a simple 3 times a week routine. Cavilon spray can be purchased at Hauser's Pharmacy in the main area of the hospital. You may wish to purchase it on the day of your CT simulation while you're here at the Walker Family Cancer Center. If you have any questions about these instructions, please contact the Walker Family Cancer Center.